We understand that your time is important and is very valuable. We certainly appreciate and respect that you've taken our time to come to an event like this one. Um, we think that what's going to be presented to you has a great deal of value, and the reason we can say that is not because of me, but because of Dr. Kedar Prasad. Now, Dr. Prasad has forgotten more than most of us know. I am not a doctor. I'm just a researcher and an educator. My goal is to try to create a my goal was to try to create a platform where we could pass on information like this that most of us rarely have an opportunity to tap into. Sure, you can sit down on the internet, you can Google things, you can AI things, you can do all kinds of things. But you know what? I think most of us realize it's hard to know exactly what to trust. It really is, because you can pretty much make an AI say or do almost anything you want. So if you can find a trusted source for information, you're much, much better off for that. So that's what we try to do. We try to establish a platform where trusted information can be disseminated. And if you know me, if you know Jeff Ashby, you know someone else who knows one of us, you know Dr. Prasad, you know Horace, you know all these different folks around you, and they've seen and experienced good results, then you're getting trusted information. And I guarantee you that the information has been carefully researched and is valid. And share with you the credentials of Dr. Prasad in just a couple moments as we introduce our program. But for the record, my name is Jonathan Jones. It's my pleasure, my privilege to be your host and moderator for this afternoon. And today is July the 27th, 2025, and it's about 5 minutes after 5 o'clock Eastern Standard Time. And this program is launched every Sunday at the same time. So if you're wondering if there's going to be another presentation next Sunday, the answer is yes. If you're wondering if there was one last Sunday, the answer is yes. If you're wondering if there's going to be one 2 weeks from now, the answer is yes. So I think we've missed maybe one event in the past 3 or 4 years, one Sunday. So we try to stick with this, and we have hosts from all over the place. One of our favorite host for this Sunday program is Jeff Ashby, because Jeff Ashby has been around the block for a number of years. He's the one that introduced most of us to Dr. Prasad and his formulas, and we're so appreciative of what Jeff has made available to us. So you can look forward to seeing Jeff on the program next week or the week after. So we'll announce that as soon as we are able to. But just have confidence that every Sunday at 5 o'clock there will be a program. Now, the law requires that we make sure that we don't give you the wrong impression. So we're by law not allowed to give you the impression that anything we're talking about is designed to present medical advice, and that we're talking about something being a treatment or cure for disease. So by law, we have to tell you this. The FDA has not evaluated the statements that we're making. You're going to hear testimonials. They're purely anecdotal. Results are atypical. That means that what happens to one person may or may not happen to you. Neither the Healthcare Support Association of America, Engage Global, Dr. Prasad, Jonathan Jones, nor any of the authorized representatives, hosts, or co-hosts are making claims that any supplements or formulas that we recommend will treat or cure any disease state. This presentation is for information and educational purposes solamente. It is not intended to be a substitute for a visit to your doctor. We strongly recommend that you seek the competent medical advice of professionals that you trust. Now, having said that, once again, I guarantee you that the information that you're about to hear has been carefully researched, and you can take this information into consideration when you're making decisions about your health and your well-being. We're talking about sarcoma, and that's what today's focus is on, because this month was declared Sarcoma Cancer Awareness Month. What exactly is sarcoma? We hear so many different. Most people, when they go to the doctor, they get that dreaded diagnosis of having some form of cancer. There's so many different ways that it can be expressed. But the word sarcoma is the one that we're focusing on today. And by definition, you can see what it says. It's a rare cancer. It starts in the body's connective tissues. And that can be muscle, bone, fat, blood vessels, and cartilage. That's specifically what sarcoma is. Two main types, soft tissue and bone sarcoma, but they can occur almost anywhere in the body, almost anywhere. The image you're looking at there, I think that's a blood sarcoma. that's was being depicted there. This one is bone that you're looking at now, this picture. But it accounts for approximately 1% of all adult cancers. And we know that cancer is going out of control right now. It is still the number 2 cause of death in this country, and it's trying to close the gap on heart disease. The number is rising. In the past few years, scientists have coined the expression turbo cancer because now cancers in general are manifesting for the first time as stage 4. So it used to be a time when you could start to see, okay, it's beginning here, maybe starting there. There's a spot here, there's something showing up there. But now a person can be completely healthy and normal. And the first time that they are diagnosed with any type of cancer, doctors are telling them it's stage 4. And I'm sorry, there's not much that we can do for you. And they desperately try to do all kinds of things. But sarcoma in particular represents about 1% of all adult cancers. And it represents about 15% of all childhood cancers. More than 70 sarcoma subtypes exist. And they can develop in the limbs, the abdomen, chest, or the head. So they can be pretty much anywhere in the body. Statistically, there is about 14,900 new cases in the United States. The estimated number of deaths, about 5,300. And you can see the 5-year survival rate is approximately 65%. And 60 and 70% with the 2 different types of sarcoma that's specified here. Early detection significantly improves outcome. So that's always been recommended. I remember we had a breast cancer awareness event that maybe goes back about 10 or 15 years. And a doctor, an oncologist, volunteered to promote our event. And it was very nice that he was promoting the event. We're very, very happy that that happened. But the thing that he mentioned more than anything was the importance of early detection. So that kept being stated over and over and over again. So we do not go against anything doctors recommend. So we're happy for people to make sure that you stay in close contact with your doctor. But again, this is information that you need to be aware of because there's things you can do that can help you to improve the outcome, regardless of what type of cancer you might be dealing with. Now, here's an interesting fact. The World Health Organization, not many years ago, has said that cell phones may cause cancer. And we insert this or keep this information in there because there's a lot of people who say to themselves, well, I don't know how this happened. I don't know where this came from. I was fine yesterday. But Dr. Prasad is the world's first radiation biology PhD, and maybe he can shed some light on the subject as to what role radiation from any source could play when it comes to cancer. But the World Health Organization says that cell phones may cause cancer. And to that end, I did a little research, and not many years ago, I'm not going to try to go with the specifics right now because I don't remember them off the top of my head, but not many years ago, leukemia was the number 1 form of cancer in children. Not many years ago. But if you roll back time about 10 years or so ago, so I'm going to say approximately 10 years ago, something happened, something changed, something very much changed. Glioblastoma became the number 1 form of cancer in children. And you may be saying to yourself, well, why did that change take place? And I can't speculate, but right now we're talking about cell phones and electronic devices. And I've seen it, you've seen it, and maybe you're even guilty of it if you have children. But many parents and many families now have more than one electronic device, more than one cell phone. Everyone in the house, in some cases, have an electronic device that they can communicate on, or they can play games on, or they can do whatever they want to with it. Just and that's fine, because I personally have mine, right here in front of me. I always carry it. If I leave the house, I don't care how far away I am, I will turn around and go back and get it. So I will not be too far away from it. But ask yourself the question, is there a potential connection? Well, the World Health Organization says that there is. So you need to be aware of that. So no matter whether you believe or accept anything that's being said in this presentation today or not, those are just the facts. Those are just the facts. If you do nothing else to take any action whatsoever going forward, an ounce of prevention is better than a pound of cure. Is there something you can do to mitigate the potential risk of any form of radiation leading to a damaged DNA? If DNA of a cell becomes damaged, that cell becomes abnormal. If that abnormal cell is not addressed by the immune system, it can mutate. If it continues to not mutate, but duplicate, if it continues to replicate itself, it can become a tumor. So again, Dr. Prasad can tell us a little bit more about how cancer starts when it as with respect to radiation. But I just wanted to pass that on so that if for no other reason, and you're on the fence about whether you should be doing something, taking something prophylactically, if such a thing exists, that should give you adequate reason to consider that. The most common treatments for sarcoma include surgery, radiation therapy, and chemotherapy. Those are just a few on the list. Targeted therapy is also on the list, and immunotherapy and clinical trials. So these are just some of the things that that AI put together as a list of ways that sarcomas are most commonly treated. Now, I think everybody's aware that most of the conventional treatments have side effects. My brother-in-law, 12 years ago, came down with colorectal cancer, and it manifests at stage 4. So he had colon surgery right away. He had a colostomy bag, and they began treating him with chemotherapy, and they threw the kitchen sink at him. And unfortunately, the side effects for him were horrible because they had to put him on a pain medication, Dilaudid. And it turns out the pain medication, when combined with the particular experimental chemo that they eventually went to, turned his colon, what was left of his colon, into a galvanized pipe. I say galvanized pipe. That's just my expression. It froze it. It just stopped it. So there was no longer any movement in his colon whatsoever, and he did not last much longer after that. So side effects are real. Side effects are very real. What are they? Nausea, vomiting, very common. Extreme fatigue, very common. Hair loss, very common. Immunocompromise, very common. Cognitive impairment, or chemo brain, they refer to it. I believe my brother-in-law had chemo brain because he was talking out of the side of his mouth most of the time, out of the side of his head. It was really, really sad what my poor brother-in-law went through. And then this one screen here, this slide, if you want to take a screenshot of something that gives you a basic synopsis of all of the most common side effects, this is the one to take a screenshot of. And then when it comes to cancer therapies, Dr. Prasad said that immunotherapy is one of the most, the one that is has the least amount of side effects. And that's proven to be true. But about 3 weeks ago, a new client contacted our office asking for help. And turns out the immunotherapy treatment she was receiving for her cancer gave her vitiligo. And I had never heard of that before. But she said she'd never had any problem with her skin or pigment in her skin. And when you look at her, she looked like she's patchwork, like a pony, and part of her was very dark skin, and other parts of it was just very, very white. All the pigment was gone. So she got that, according to her, as a side effect of the immunotherapy. So those side effects and those problems are very real. But enough about the background of this sarcoma. Let's make the transition now and talk a little bit more about what potential there is for dealing with and addressing this situation. I'm the least qualified to be able to do that. I want to introduce to our discussion now Dr. Prasad. Dr. Prasad has been doing research for decades. And as you can see on this list of accolades here, he was the world's first radiation biology PhD. His products, his formulas have been awarded 10 US patents in the category of micronutrients. His lab and his research has been funded by a number of organizations, not the least of which has been the United States Congress and NASA and private sector. So he's had millions of dollars poured into him for research. During that time period, Dr. Prasad discovered the anti-cancer potency of vitamin E succinate. Now, if you're like me, I've been in the research world and the nutrition world for probably 40 years. I didn't even know that there was more than one type of vitamin E. So there's like 6 of them, I think. But of the 6 of them, turns out there's only one of them that, oh, by the way, just happens to kill cancer cells while it's doing what all the other vitamin E's do. This is the scientist who discovered that. He's the man who is credited. Just like Newton was credited with figuring out gravity, this is the man who figured out that there's one particular type of vitamin E that is an anti-cancer agent, and it's called vitamin E succinate. Now, you should be asking yourself a question. I wonder which vitamin E Dr. Prasad put in his formula. It would not take rocket science to figure out that that's the one that this man chose to put in all of his formulas. So I'm thrilled about that, because one of the things that it happens to do, it also happens to cross the blood-brain barrier. So if you got some vitamin E rolling around in your head, I'm just thrilled that it's also, while it's doing what it does, making me feel good, it's also killing some cancer cells while it's up there. So I'm just thrilled about that. So I keep a lot of that stuff in my body personally. Dr. Prasad also is the scientist who discovered that butyric acid is an anti-cancer agent. Now, you might be saying, so what? And you have a right to do that. But understand something. Butyric acid forms in the gut when good bacteria eat certain things. The byproduct of that is butyric acid. If you happen to be eating a certain kind of bacteria, I don't know about you, but I'm glad that this is the man who formulated the probiotic that I'm consuming, because it's going to be, oh, by the way, killing some cancer cells while it does what it does. So I'm thrilled about that personally. Basically, we're looking at a formulator, a scientist who didn't graduate from college wishing to be a product formulator. This is a man who lived his life and took his expertise and became a formulator. Does that make sense? This is the man who, look at the rest of his credentials. He was a professor at University of Colorado School of Medicine for more than 30 years, director of vitamin and cancer research, former president of the International Society of Cancer Nutrition, invited member of the Royal Society of Medicine in London, invited member of the Nobel Peace Prize nominating committee candidates in the category of medicine. That he's got a storied background, bottom line. Authored or co-authored some 33 books, published more than 250 times in peer-reviewed articles. You can go to PubMed and put Dr. Prasad's name in there. Dr. Kedar M. Prasad, put his name in there, and you'll find at least 450 references to this man's work. So I don't know if there's anything else that could convince you of this man's credentials. I don't know what that would be, but I'm going to just stop right now and let's move out of the way. And let's take a minute now to take some time and talk to Dr. Kedar Prasad and see what Dr. Prasad is going to share with us when it comes to this matter of sarcoma. And remember what I told you, this man has forgotten more than most of us know. So Dr. Prasad, thank you very much, sir, for your being willing to take time out of your busy schedule and join us on Sunday afternoons like this. Thank you for joining us.
Yeah, first, I'm always happy every Sunday to be with you, Jonathan, and with my engaged family members who are attending today, and appreciate very much. And but first, let us see what are the external forces or external risk factor that induces cancer in general, sarcoma, makes no difference. It is process is same.
The process for any kind of cancer, including
Yeah,
sarcoma, is
the
all the
environment
same.
factor is same. Environment
Okay, so
factor
this
is
one is rare,
common.
but it's the same. Okay, go ahead,
Yeah.
please.
Of course, classical, the well-known is poor diet, and
Right.
we are talking about smoking and so on. But with respect to radiation, Jonathan, that you talked, there's ionizing radiation that we know they induce cancer. and I will tell you how they do it. But also new player come into picture, which is called electromagnetic radiation,
Yeah.
electromagnetic field radiation,
Wait a minute, I got your back.
EMF radiation. So EMF radiation for example, ionizing radiation or ultraviolet radiation, for example, you can block it. By ionizing radiation, you can do with lead shielding, you can markedly reduce it. But with EMF radiation, because it has also magnetic field radiation, which you cannot block it.
Oh, wow.
So, because electrical field radiation, you can block it, but it is a combination of electromagnetic field, and so at certain frequency that we emit it.
Hold on, Dr. Prasad. So
Yes.
what you're saying there basically is like if I go to the dentist, they can put something on to block me, and the dentist, they go behind some wall, they're blocking the radiation for them. That's the kind of radiation that can be blocked.
Blocked, right. Outside radiation, blocked. But EMF radiation, you cannot block it.
Oh,
Physical shielding,
will
and
not block it.
there was the people examined the Department of, I don't know, Consumers Protection Agency, examined the EMF radiation, and because sometimes people are having some kind of shield on their cell phone, knowing it will protect them.
Yeah.
But when they analyze it, they come out conclusion this will have a positive effect because once you shield it with something that is they try to shield it, some metal, and so then your system, the cell phone, will have to work hard to draw energy to function it. While doing so, you will be exposed to more EMF
Even
radiation
more radiation.
than without protection.
Oh, my goodness.
That was consumer support, very expert advice. So the question would be then, first, how they do it. Well, this has been documented. Electromagnetic field radiations and ionizing radiation is common in one thing. They both produce free radicals.
Okay.
And then I will tell you how it damages it. But electromagnetic have another mechanism that is not shared by by ionizing radiation, and that mechanism it has a property, the man-made electromagnetic field, not nature's made electromagnetic field. Man-made electromagnetic field, it vibrates the charged particles in your body, in the brain, especially it is in the brain, and it's all over the place, but especially brain. And when they are vibrating molecule charged particles like potassium, calcium, many are, and so then what do you do? But if you take an antioxidant, for example, they donate electron to neutralize those charged particles. So now they can be vibrated.
Okay.
So this is very important to remember it. And that's the reason you have also, because it not only messed up communication, some people that we know, or Dr. Code, very sensitive to this type of things. And as soon as you take micro daily EMF, then it immediately get restored his mental function.
Oh,
But
wow.
also long-term function is, other parts of the body is also protected if you are taking it. So this is in another differences. Now, as far as the evidence is concerned, there are some evidence, solid evidence, in animal model, because it is difficult to perform epidemiology study because not everybody will get exposed to the same amount of EMF radiation absorption, you have a distance, it can be controlled.
Right.
But in any model, you can give them precise magnetic field, how many is there at the EMF radiation, and you can how much is being absorbed, and so on and so forth, precise.
Right.
And under that condition, in a national laboratory of the National Health Center in South someplace, they did it funded by government, federal government, and they found that incidence of especially brain cancer markedly increased in the animal model. And they were looking, because at that time epidemiology suggested that even human, the brain cancer incidence has increased, but nobody believed it.
Yeah.
So at least the animal model
Yeah.
is the case.
They proved
Another,
it.
another epidemiology study was that a woman who was keeping her cell phone under the breast hair,
Yep. Yep.
they developed breast cancer.
Okay.
And so these are the things that X radiation, you can control it, but but you have to go to dental X-ray, you have to go chest X-ray, many other reasons for older people like me. But so the question is, how do you protect against that? And
Hmm.
also, how do you protect against these things? But before that, we will say how these things causes cancer, whether
Right.
it's sarcoma or leukemia or glioblastoma or any kind of sonoma tumor in the brain and so on. But here is the thing: all cells have three type of genes. One is called oncogene. That means they are there, but if they get activated by chance, it's all chance. It is happening all over mutation is occurring all over the genes, but by
Yeah.
chance,
Yeah.
it hit the oncogene, it get activated, and that particular the sarcoma or leukemic or any kind of cell become cancerous.
Oh boy, that's not good.
That's one mechanism. And then I will tell you how one can protect it. Another is called tumor suppressor gene.
Okay.
Tumor suppressor gene is gene which would not allow to cell become cancerous. But if you call mutation, then they get downregulated, decrease it instead of being downregulated. And if downregulated, then becomes open to division.
Yeah. Yeah.
And third one, which I proposed in the early 70s, is the differentiation gene. Because what happens, normal cell generally divide for some time, then differentiate, and then they die. This is the normal pattern. That's why our body maintains it, get rid of old cell, new cell is formed. But if there is a genes which control differentiation of cells, get mutation. Now normal cell keep dividing, cannot differentiate it, and if they keep dividing, they become cancerous. And then of course, when you are dividing and without any reason, and then become more susceptible to activation of oncogene and uh, tumor suppression gene and so on.
Dr.
So
Prasad, you're saying a lot of stuff here about genes, and that's kind of scary. So if anybody's doing something that potentially could have an impact on my genes,
yes,
turning them on or turning them off, that's not a good thing. I need my genes to be stable.
yes, stable, and that's why I will tell you how to make it stable, prevent them from
Yeah.
mutation. And so this is the mechanism to all kind of cancer, no matter what kind of cancer is sarcoma, leukemia. This is the way they get converted to cancer cell. So the question is, in this case, free radicals are one of the thing. Environmental agent or many agents are there. Many things we can control, like EMF radiation, we can't control. So what we can do, the best thing to do to protect it. Free radical damage increases oxidative stress in your body. Well known. Because our body is protected by antioxidant system, and there's another a smaller part is endocannabinoid system. But if both get suppressed, then free radicals will be there, and excess amount of free radical will start causing damage. And if the damaged cell cannot repair fully, they induce chronic inflammation.
Mhm.
So now, and chronic inflammation produce lot of toxic chemicals and also additional amount of free radicals. So
Mhm.
you see the combination of these two factors, no
Right.
matter how environmental agents are there, makes no difference. They all produce these things.
But the environmental agents, the food we eat, all makes it all worse.
Yeah, and so the question is, so how do you reduce it? Because you can't control many aspects of the environment.
That's right.
You can, even a diet, we can't control it.
Right.
We have been recommended good diet, healthy lifestyle, don't smoke. how many people
But
follow it?
and Dr. Prasad, a lot of people eat perfectly good food, organic food, and they still get cancer. So
Still, because there is some other agents, environmental agents,
right,
you can control, like EMF radiation is one of them.
right.
Many environment pollution in the environment, you
Hmm.
can't control
Can't
pollution.
control that.
No, you have to go outside, you have to go exercise and so on.
That's
Live in
right.
a city more and less.
That's
Some
right.
are more environment pollution, some are less water polluted. So these are the things some control. We can control some, but not enough to make a difference. But if we block the action of oxidative stress and inflammation, then your gene cannot be mutated without them.
Okay. Okay.
So question is, how do you do it?
Okay.
Yeah.
Antioxidants.
And then you said, well, antioxidant was well known to reduce oxidative stress and inflammation. But many people are using the clinical trial a single agents. Remember beta carotene trial
Yeah.
performed by Harvard? But it was known for hundreds of years or more since antioxidant discovered that if you use individual antioxidant
Hmm.
in a person who has already some kind of disease, that means have a high oxidative environment like
Hmm.
cancer, the individual antioxidant will be oxidized in the presence of high oxidative stress, and therefore it will act as a pro-oxidant rather than as an antioxidant. So
Okay.
your
That's
purpose will be dead. If anything, either no effect or it will increase the risk. And this
okay.
is what
So
happened beta
what
carotene
you what
trial.
you just said is the reason why oncologists will sometimes recommend to their patients not to take any kind of antioxidants because they believe it's going to actually make the situation worse. And it has been in a
Yes.
single antioxidant.
Yeah, and not only worse. In this case, the trial was in a smoker, and it would make it worse. But also, the oncologist fear is justified
Right.
because the low dose of antioxidant that we use in prevention purpose,
Right.
like we have in EMF, low dose antioxidant will blocks the free radical damage that chemotherapy and
Chemo is trying
radiation
to.
therapy produces by mechanism which they kill the cancer cell and also some normal cell.
Right.
So this is not the case. It is not good idea to use low dose antioxidant during chemo for anything. Even though it was a cancer cell that we established ourselves, a normal cell counterpart. It turned out that low dose of antioxidant stimulates, without doing anything, just stimulates the growth of cancer cell.
Yeah,
So
that's
it's
not good.
dangerous for anybody when you have a cancer, just go buy antioxidant.
Hmm.
It
Hmm.
stimulates. So not only interfere with the action of chemo and radiation therapy, but even if you don't take those things, just take antioxidant, you
Yeah.
buy multivitamin or you buy from us, Engage Global, they will they will increase the growth of not all cancer, but some cancer, but you don't know
Right.
which
Right.
cancer. And so this is the case. So the question is, so another thing that play a very central role in cancer is the intestinal dysbiosis. Intestinal dysbiosis is the number of harmful bacteria increases and declines in the number of beneficial bacteria. We define them as intestinal dysbiosis.
Right.
And intestinal dysbiosis produces a lot of pro-inflammatory cytokines, which are very damaging to things, cells. Not only you mentioned the acute effect of radiation chemotherapy, but late effect is a reoccurrence of the primary tumor
Right.
and induction of new primary tumor at a distant site.
Hmm.
How they do it? Because when you kill the cell, they use a lot of inflammatory molecules, and they migrate and affects to other site and changes the gene, various type of genes, and become cancerous. So you need to protect them as well, not only
Hmm.
acute effect, but late adverse effect.
Right.
And so in this case, that the question is that is so, and also I wrote a paper and published it that intestinal dysbiosis not only contributes to the initiation and progression of all cancer, but it also reduces the effectiveness of radiation and chemotherapy by increasing their toxicity, acute toxicity. So question is, nobody takes care of that while you are getting radiation or chemotherapy.
No.
So my recommendation is always. So in doing so, as you know, we discovered for a long time ago. Actually, as you know, Linus Pauling, who was the two Nobel laureate, first discovered that high dose of single vitamin C can kill cancer cell. That was
Yes.
it. In a patient. Didn't do any experiment in a patient. But the clinical study could not be reproduced by other people who did it, not following the exact same protocol. But anyway,
Right.
it created a lot of controversy, and they started thinking about, oh, Linus Pauling is an old man, and even can you believe two Nobel laureate can get an NIH grant? Well,
Wow.
I'm not even one Nobel laureate or even close to. But, and I was, many people like me was getting an NIH grant, and I had an NIH grant at that time. So I
Wow.
said, this guy is a Nobel laureate. It can't be that wrong. Let me test it. Even though I was busy in something else, I just discovered a major discovery that if you elevate cyclic AMP in neuroblastoma cell, they become mature neuron and no more cancerous cell.
Wow.
That made me very famous, and at that time, and I got a lot of NIH grant. But
Wow.
anyway, and so, but I said, okay, that will go on because I had all kind of help, assistance. But I said, I want to test on neuroblastoma cell if vitamin C kills it. And sure enough, vitamin C killed it. And then I said, let's see what happens if you combine with X radiation or chemotherapeutic agent. Sure enough, it enhances. Linus Pauling didn't try it. He just tried alone. But I experiment, and sure enough, it enhances the effect of chemotherapy and radiation
That's what I'm talking about.
on cancer cell, neuroblastoma cell, while protecting the normal tissue, like fibroblast culture.
Hmm.
I was working in a culture. And so I said, well, okay, but what other kind of vitamin can do it? So
Yeah.
then vitamin E Succinate I tried, as you mentioned. And then, so the question was high dose antioxidant, and I tried multiple antioxidants and published a lot of paper on this issue. And so, but nobody believed it. Nobody, the word antioxidant was deadly for oncology.
Incredible.
Yeah. And so now, then when one day I was thinking that do cancer cells require a specific nutrient that they need it, otherwise they will die. So I looked the literature, sure it was there. They require glucose and glutamine for survival. If you block any one of them, they will die.
That's what I'm talking about.
No matter what kind of cancer, that makes no difference. Whether
Right.
cancer cell like, at any stage,
Yeah.
and whether that the treatment is sensitive to radiation or chemotherapy or became resistant to therapy, makes no difference as long as you are cancer cell.
Bye-bye sarcoma.
Yeah, but sarcoma is same thing. And also, so you need a glucose and glutamine.
Right.
Then it occurs to me, maybe it is possible that high dose antioxidant
Would block it
block it. Then I said,
selectively,
yeah, how do I
selectively
know?
in cancer cells only.
Yeah, only on cancer. So I said, "Oh, I don't know." So again, I looked the literature. Sure enough, individual antioxidant blocks the uptake of glucose. Some will block the uptake of glucose. Others will do block the uptake of glutamine.
Glutamine.
And so I said, well, then that means I was okay. I was having a multiple antioxidant without knowing these differences. You see what I mean? And then, as you know, we have patented it. We got patent on this issue. But in the
Yep.
meanwhile, our main goal is to run a clinical study, phase 1, phase 2, 3, and we are trying to raise fund and get a FDA approval. But in the meanwhile, it takes a long time to do all this kind of stuff.
Yep.
In people like our affiliate or cancer customers have a cancer, what do you do? So I started recommending 3 times, as you know, 3 times of micro daily, which is normal doses,
Hmm.
three times of the normal dose,
Right.
morning, noontime, and evening after meal, each time after meal, and probiotics with prebiotics that we have. I
Hmm.
start recommending it, and the result is, I can't even believe it.
Yep.
It is
Yep.
so phenomenal that it is amazing. But still, oncologists shy away because until get FDA approval, it is not nobody is going to pay attention to. We
That's
can make
right.
100 people, like right now we have helped 50 people. They're all cancer free.
Hmm.
And so maybe another 50 or 100 or 200, but not nationwide, not worldwide, without FDA approval.
That's
And
right.
I can convince the investor to pay some money,
Well,
$500,000. We can run a clinical trial here, phase 1, as a cancer center. They're ready to do it.
yep.
We
Just
tried
need the
to do
funding
in
for it.
Brazil. We tried to do in Brazil, but people promised the funding, but backed off.
Yeah.
So, but anyway, you know me, I don't give up.
Oh no, we're not. We're not gonna.
So,
We're
so
not
the
gonna stop.
question is, that in sarcoma case too, as well, even in fourth, like you mentioned, it detected fourth stage. Not only some other cancer detected at fourth stage too, but sarcoma. And so you take a high dose antioxidant like we are recommending, and if you are going to have a chemotherapy, this is okay. But you do either, before you start it, and continue a month after you start it, and
Right.
you will see the result. Or
Wow.
some people, for they get fearful, don't take it antioxidant, and like one case that mentioned in Ecuador, maybe for financial reason or whatever reason, this woman refused to take. She has melanoma, high fourth stage melanoma, and refused to take any chemo radiation therapy. And doctor said, you are going to have a, what do you call,
Amputation.
yeah. And so went to this one, and within a month, the cancer was totally healed.
That's right. That's right. We this is for real. These are all anecdotal stories,
Yeah,
but
no, no,
it is.
total story, because you can't publish it, because
That's right.
I asked oncologist, can you give me the data, and you go as a case report, but nobody is ready to do it
They
because it's
won't do it.
too
They
good to be
won't do it,
true.
Dr. Prasad. They won't do it.
I
And I
know.
think that just for the sake of, especially some of the ones who are here for the first time, brand new, some of the cases that you're talking about right now, we're going to just maybe just thumb through a couple of pictures here,
Sure, yeah, I think it's a good
and
idea.
it could be a couple of folks that are here right now that have found themselves benefiting from cancer perspective that want to share their story. So we'll listen to them also. But this is just a reminder, folks, of the disclaimer as we talk about these cases. Here's one woman right here. She took chemotherapy and radiation, and she had surgery. But she also took Dr. Prasad's formulas during the entire time period. When she tells her story, she says she had she didn't lose her hair, she had no pain, even when she was declared cancer free and put on the tamoxifen afterwards, she had no pain as a result of it because she remained on Dr. Prasad's formula the entire time. Now, if anybody's here that does not want to look at an open wound, I'm about to show a picture with a gentleman before and after that had cancer on his face. So you might want to look away from your screen right now. This gentleman right here,
Yeah, basal cell carcinoma. Yeah.
basal cell carcinoma. Now, would that be considered a form of sarcoma?
Yes. Yeah.
Oh, okay. So here's what we're talking about right here. This man had this hole going through his face, and
Receive a lot of chemo. She received
radiation.
proton radiation therapy, because proton is much more damaging than X-ray and radiation,
Wow.
and that's why you see the lesion. But once they are on the program later on, and then you can see that it's totally healed.
And Dr. Prasad, it was only August of 2023 to November. So that's August, September, October, November. That's not even 4 full months.
I know, I know,
This is just mind-boggling, just mind-boggling.
I know, I know.
And
This is, but it's hard to convince those oncologists to go with me as a case report.
that's right. That's right. Yep. I know, because I've tried to approach some of them to do that exact same thing. Now, here's the case you were talking about before, the woman down in Ecuador, who
Yeah,
this is her official diagnosis was melanoma.
yeah,
And once again, folks, if somebody does not want to see an open wound, this is not the next slide. You don't want to look at this one, but this is the one Dr. Prasad was talking about right here,
yeah,
where
melanoma. Yeah,
So this is would this be soft tissue also? Is that a form of sarcoma?
No, melanoma is totally different type of cancer
Okay.
from
Okay.
melanocytes, and it is, it would not be considered sarcoma. No,
Ah, yeah.
it is
So
by
that's
itself
just
like a leukemia. It is by itself a separate type of tumor.
yeah. So that's right. Like so
And melanoma is
subcutaneous.
tough to treat with radiation or chemotherapy because so much resistance,
Mm-hmm. Mm-hmm.
because it has
Wow.
a lot of melanin.
Well, you could see all around the edges there, necrosis was starting to set in. So this thing is eating her alive, and very painful, and having difficulty walking. And Charlie told us that the doctor was going to was talking about amputating so that she
Yeah,
wouldn't die.
yeah,
But she started on Dr. Prasad's formula, folks, just as he suggested, tripled the normal doses. And I think everybody just needs to understand that because we always get this question a lot, Dr. Prasad. They always keep asking us, how much did they take? Triple the normal dose, three
yeah,
times a day. That's all. That's
yeah,
it. So you can always talk to the person who invited you to this discussion and they'll explain what that means for you. So three times a normal dose. That could be either the microdaily original or the EMF, whichever the
yeah,
case, whichever one you use. Triple
yeah,
the normal dose three
yeah.
times a day. But look what happened here, Dr. Prasad. This is just a couple of weeks later. So that first picture was taken on April the 18th.
Hmm.
April the 18th. This picture is taken April 22nd.
Yeah,
So this is just 4 days later.
yeah,
This picture is taken April 28th.
uh,
Another 4 days later.
yeah,
The necrosis is gone. The whole
yeah,
wound is starting to dry up. This picture is taken May the 2nd,
yeah.
4 days later, and it's
Right.
almost gone. You can barely see anything at all. So this is before on the left and after on the right.
I mean,
This
nobody will believe it.
nobody will believe it, Dr. Prasad.
Yeah.
Yeah,
So, but if it were in an under control condition in an oncology center, then they would have said, and I should have jumped and fund as much money as you want.
that's right. If it had been under some controlled environment that was clinical, and then they could say that this is for real. But I'll tell you, Dr. Prasad, all we know, and I feel confident when I pass on to people this statement right here. So if anybody wants to take a screenshot and just get a summary of Dr. Prasad's research, a summary of what Dr. Prasad recommends, this is it right here. This is it. He said, you heard him say it earlier, cancer cells require two things, glucose and glutamine, in order to survive. He says, all you have to do is block one of them, not even both of them, deprive the cell of those two things. But he just told us a minute ago, just one of them blocked, and the cancer cell can't survive. So his recommendation is to put yourself on high doses of his formulas, high doses of his formula, along with the probiotics. And then you're giving yourself a chance. You just let your body do what it does. So now remember, we just showed you that same disclaimer 3 times. We're not talking about a treatment or cure for any disease, not at all. But we are saying Dr. Prasad's formula mimics what his research has proven, that high doses of antioxidants inhibits the uptake of glucose and glutamine in cancer cells, but not in healthy cells. So the rest of the body is unaffected by it at all. No
Yeah.
effect whatsoever. So that's the part that makes us excited.
Another thing is very important that with this one, if you are going to get the radiation or chemotherapy, they
Mm-hmm.
will reduce their during therapy acute toxicity and as well as the long-term toxicity of another neoplastic or non-neoplastic diseases.
Wow. Wow. So we're talking about giving yourself a real fighting chance. So your whole
Yep.
body becomes healthier
Yes,
no
exactly.
matter what the treatment is.
Yeah. And
Wow.
once they get protected at that time, then it is unlikely. Omega-3 is very important for your brain and hearts. It is
That's
not
right.
directly relevant to a cancer
Not
treatment.
the cancer.
Uh,
And then the
uh, uh,
collagen, we don't want them to
and
take
collagen,
collagen at
no, no.
all,
Collagen, no, no.
not during cancer treatment. So no
Yeah,
collagen.
if you have any kind of cancer before or during treatment or after treatment, because until you have become cancer free, because collagen has some compound that it blocks the entry of a lymphocyte killing tumor cell to the site of the tumor, so tumor can grow faster. if you
Okay.
if you are taking collagen peptides.
Okay. So no
Uh,
collagen peptide when you're being
No,
treated for cancer.
and digestive boost is always interesting because you when you're taking chemotherapy and radiation therapy, there is some
Yes.
stuff
Yes.
there, and it can interfere with the digestive boost.
Right.
And and if you are not healthy your gut, then this can create all kind of issues, absorption of micronutrient and so on. So it just as a preventive care. It is not absolutely necessary.
Right. Okay. That's additional support. And brain boost would be great for anyone who's dealing with chemo brain
Chemo brain, yeah.
and
And
brain
many
fog.
people, and as you know, many customers have reported that they have tremendous benefit adding a brain boost in their approved
Yeah,
formula.
well, I keep about 10 bottles in on my shelf and I will not run
Myself.
out. I take two of these twice a day, period.
Yeah,
And
yeah,
if I need an extra bump somewhere in there, I take more. And the sleep boost, oh my Lord, this stuff is phenomenal, folks. So if you really
yeah,
want to improve your quality of sleep, you take one, two, or three of those at bedtime, and you'll fall off into la la land. And I dare you to add it to the CBD boost. I take two of these and two of those sleep boosts. I go into a coma. I do not
yeah,
wake up until I'm done sleeping in the morning. Period.
yeah.
So
And
that's a
again, CBD has been ignored because of the fear of that it is addictive, but it is not addictive. It is safe,
that's right.
and this is the only compound which can is safe, can increase the serotonin level in your gut, not only
Mhm.
act as an inhibitor of serotonin reuptake, but also as a stimulator of the synthesis of new serotonin. So your brain cell has sufficient amount of serotonin, and that always reduces anxiety and depression. Not only
Wow.
that, but CBD also increases dopamine level transiently, so that you feel nice and happy. And third thing is, it also blocks the release of glutamate, which makes you hyperactive. Like we see many cases of patient with autism or any kind of a brain abnormal, behavior abnormality. CBD is a must. I take
Wow.
CBD even though I don't have those kind of issue, but for my age, I just as a preventive care, I take CBD in the evening
Yep.
before going to bed.
Absolutely. I have it by my bedside. I've got several bottles. I keep this in stock. I will not ever run out of this. And I hope everybody understood that. And I'm just going to emphasize one thing for people that there are many depression drugs that are serotonin reuptake inhibitors,
Yeah,
many
but they produce
depression drugs,
toxicity. Yeah,
but they have toxicity, they have side effects. And Dr. Prasad just said that this behaves, one of the things it does, it acts as a serotonin reuptake inhibitor, but there's no
inhibitor.
side effects to this.
Yes,
So that's the same exact function as some depression drugs, but
yeah,
with this one has no side effects. So
yeah.
if you want to give yourself a better chance of perhaps dealing
Like
with,
Prozac.
okay,
It's in an inhibitor of serotonin reuptake, but it has have value. It decreases it, but it also has some toxicity.
look at that. Prozac is in that category. So just to kind of wrap up our discussion, folks, for those of you who are only interested in feeling better and overall wellness, the core four is what Dr. Prasad
Yes.
recommends for overall wellness. The individual ingredients on all of these products that you're looking at right now, I think I estimated at one time using AI somewhere around $1,000 if you tried to buy all the individual ingredients. But what when Dr. Prasad put the formula together, you don't have to figure out how much of which item to take. Even if you pay for it retail, it's only $310, $312, somewhere in that area. But Engage Global has made it so that those of us who are affiliates or even preferred customers can buy it at a discounted price. The discounted price will be about $250, but they have made it even cheaper than that. So I can't even buy it for this price. For those of you who are here, like for the first time, you want to try this is the way to go. You can get it for a subsidized price. It's only about $200 to get that. And I highly recommend. Dr. Prasad has said it to us over and over and over again. It takes at least 90 days to get it into your system to make sure that you're getting the full effects of it. So you stay on it for at least 90 days, then you'll know what it's doing for you. Then in addition to that, if all you can do is just the micro daily formula, and the probiotic, this is the basic bundle right here.
Basic
So
bundle, yeah.
this is the absolute lowest level for anyone who has, financial problems or challenges. And as you can see, it's about $110 for this one. And they do have an even cheaper basic bundle because there's a basic bundle with the original formula to Dr. Prasad, and that's $90.
Yeah.
So if someone really wants to just, because of budgetary issues, you can get the basic bundle with the Micro Daily original formula, which is about $90.
Yeah.
And that's a cheaper way to go also.
Yeah.
But basically, you just get back with the person who invited you to this discussion, and they will help you to figure out which bundles would be best for you. Okay. So, Dr. Prasad, I tell you, this is you've kind of blown our mind here with the stuff that you pass on to us, and I keep telling people, I say sarcastically that you've forgotten more than most of us know, but every time we have a presentation here, you blow us away with some new thing that we haven't heard before.
I'm happy that the age of 90 plus, still I'm doing it okay.
Yes, sir. Yes, sir. At over 90 years of age, this man is still
90 plus.
Brand new work.
Yeah.
New work, new thoughts, new books, new publications, and he's not slowing down, and he never misses a beat. So we're excited that this man is on our team. We get a chance to work with this gentleman. So listen, folks, we've used up all of our time. Apologies if you do have any questions that you would like to ask.
Sure.
You can send them by email. Send them by email to me or to Jeff. I'm putting my email address in the chat. eg@jonathanjones.com, and you can send me any emails, any questions that you'd like to get to Dr. Prasad, and I give you my word, I will follow them up and make sure that he gives a response to each one of them, or on an upcoming conference we will discuss the answers to questions. Florida. So you can send the email to me here or to send it to Jeff, and we will follow it up. But Dr. Prasad, once again, we say thank you, sir. Thank you for joining us today, and we look forward to future discussions with you